Hello and welcome everyone. Myself Mizanur Rahman, and today my topic of discussion is anemia. In the previous video, we have already discussed about the two types of anemia. One is hemolytic and one is hemorrhagic anemia. Now we will try to discuss about the nutrition deficiency anemia. So let us start. First of all, nutrition deficiency anemia. Anemia that occurs due to deficiency of a nutritive substances necessary for the erythropoiesis is called nutrition deficiency anemia. So first of all, what is nutrition deficiency anemia? It is a type of anemia in which there are some deficiency of some nutritive substances. Okay, and these nutritive substances are very much important for the erythropoiesis. And as for the lack of this type of nutritional substances, erythropoiesis may be not work properly. That's why some types of anemia occur. These types of anemia are known as nutrition deficiency anemia. Now, the substances which are necessary for the erythropoiesis are iron, proteins, vitamins like vitamin C, vitamin B12, and folic acid. And the types of nutrition deficiency anemia are, first of all, iron deficiency anemia, the most commonest type of anemia. Iron deficiency anemia is the most common type of the anemia, and it develops due to the inadequate availability of the iron for hemoglobin synthesis. So, what happens here? This is the you must know a point that it is the most common type of the anemia, and it develops due to the inadequate availability of the iron for hemoglobin synthesis. Now, RBC in case of this type of anemia are microcytic and hypochromic. Now, causes of iron deficiency anemia. First of all, the first cause is loss of blood. Number 2, decreased intake of iron. Number 3, poor absorption of iron from intestine. Number 4, that is increased demand for iron in conditions like growth and pregnancy. So what happens in which case the iron deficiency anemia may occur? First of all, if someone or if somebody loses the blood, then the anemia can develop. Then the decreased intake of iron, the dietary iron is less. Then the poor absorption of iron from intestine. And number 4, that is the increased demand for iron in condition like the growth and pregnancy. Now, features of iron deficiency anemia. Features of iron deficiency anemia are brittle nails, spoon-shaped nails, which is known as koilonchiasis, brittle hair, atrophy of papilla in tongue, and dysphagia, difficulty in swallowing. So, what are the signs and symptoms by which you can know that the patient is suffering from iron deficiency anemia? That is, in case of this type of patient, you found that the nail are generally brittle, and their nail shape is spoon shaped, and their hair is not so strong. They are also brittle. Then atrophy of papilla also occurs in the tongue, and dysphagia also occurs. Next point, that is the protein deficiency anemia. Due to deficiency of proteins, the synthesis of hemoglobin is reduced, and the RBCs are macrocytic and hypochromic. Now, there are some other anemia known as pernicious anemia or Addison's anemia. Pernicious anemia is the anemia due to deficiency of the vitamin B12. So, vitamin B12 is a major component of our healthy body, and if someone lacks the vitamin B12, then he or she may be suffer from anemia. This anemia is known as pernicious anemia or Addison's anemia, and it is due to the atrophy of the gastric mucosa because of the autoimmune destruction of the parietal cells. So what happens? The main reason behind this is the atrophy of the gastric mucosa, and the reason behind this is also the autoimmune destruction of the parietal cells. Now, the gastric atrophy results in decreased production of intrinsic factor and poor absorption of vitamin B12. So, as the absorption is lacked, that's why the anemia is occurs. It decrease the production of intrinsic factor and poor absorption of vitamin B12, in which is the maturation factor or the RBC, and vitamin B12 is much more needed for the maturation of RBC. Now, RBC are larger and immature with almost normal or slightly low hemoglobin level. RBC are generally normal, but the it is not matured properly because it should be shrinked. Biconvex shaft is not formed properly, and RBC are larger and immature with almost normal and slightly low hemoglobin level. And synthesis of hemoglobin is almost normal in this type of anemia, so the hemoglobin is almost normal in this type of anemia, and so it is called macrocytic and normochromic or hypochromic. It may be normochromic, it may be hypochromic. Now, before knowing the cause of this anemia, it was very difficult to treat the patients and the disease was considered to be fatal, so it was called the pernicious anemia. So pernicious anemia is fatal, and now the pernicious anemia is common in the old age and it is the more common in females than males. So, and it is associated with other autoimmune diseases like disorders of thyroid gland, Addison's disease, and characteristic features of this type of anemia are lemon yellow color of skin. And due to anemic paleness or mild jaundice and red sore tongue of skin due to anemic paleness and mild jaundice and red sore tongue, the neurological disorders such as the paresthesia, which is abnormal sensation like numbness, tingling, burning, etc. Then progressive weakness and the ataxia, which is muscular in coordination, are also observed in extreme condition. Now, megaloblastic anemia. Megaloblastic anemia is due to the deficiency of another maturation factor called folic acid, and here the RBC are not matured and the DNA synthesis is also defective. So the nucleus remains immature and the RBCs are megaloblastic and hypochromic. So the features of pernicious anemia appear in megaloblastic anemia also. However, neurological disorders may not develop. Now, number 4, that is the aplastic anemia. Aplastic anemia is due to the disorder of the red bone marrow, and red bone marrow is reduced and replaced by fatty tissues. Now, bone marrow disorders occurs in the following condition like repeated exposure to X-ray or gamma ray radiation. Number 2, that is the presence of bacterial toxins, quinine, gold salts, benzene, radium, etc. Number 3, that is tuberculosis or TB. Number 4, that is the viral infection like hepatitis and HIV infection. And in aplastic anemia, the RBC are normocytic and normochromic. Now, the last type of anemia, that is the anemia of chronic disease. Anemia of chronic disease is the second common type of anemia next to iron deficiency anemia, and it is characterized by the short lifespan of RBC. Now, it is caused by the disturbances in iron metabolism or resistance to erythropoietin action. And anemia develops after few months of sustained disease. RBC are normocytic and normochromic in case of this also. Now, common causes of anemia of chronic disease. First of all, that is the reason is the non-infectious inflammatory disease such as rheumatoid arthritis, which is chronic inflammatory autoimmune disorder which affects the joint. Then chronic infection like tuberculosis, which is the infection caused by the Mycobacterium tuberculosis, and the abscesses, collection of pus in the infected tissue in the lungs. Number 3 reason, that is the chronic renal failure in which the erythropoietin secretion decreases, and since the erythropoietin is necessary for the stimulation of the bone marrow to produce RBCs and its deficiency may cause anemia. Then number 4, that is a neoplastic disorder, that is the abnormal and disorganized growth in tissue or organs such as Hawking's disease, that is the malignancy involving the lymphocytes. And the cancer of the lung and breast. RBCs are generally normocytic and normochromic in this type of anemia. However, in progressive disease associated with the iron deficiency, the cell become the microcytic and hypochromic. Microcytic and hypochromic. Now, we will discuss about the sign and symptoms of the anemia. Skin and the mucous membrane. The color of the skin and the mucous membrane become pale, and paleness is more constant and prominent in buccal cavity and the pharyngeal mucous membrane. conjunctivae, and the lips, ears, earlobes, then palms and nail blade, and the skin loses the elasticity and becomes thin and dry, and thinning and loss of the early grayness of the hair color, and the nail becomes brittle and easily breakable. Then cardiovascular system, there is an increase in the heart rate or tachycardia and the cardiac output, and the heart is dilated and cardiac murmurs are produced. The velocity of the blood flow is increased. Number 3, that is the respiration, there is an increase in the rate of respiration and the force of respiration is also. Now sometimes it leads to the breathlessness and the dyspnea, which is difficulty in breathing, and oxygen hemoglobin dissociation curve is shifted to the right. Now, number 4, that is the digestion, anorexia, nausea, vomiting, abdominal discomfort, and the constipation are more common. And in pernicious anemia, there is the atrophy of the papillae in the tongue. And in aplastic anemia, the necrotic lesions appears in mouth and pharynx. And the metabolism, the basal metabolic rate increases in severe anemia. And then kidney, the renal function is disturbed, and albuminuria is more common. Then reproductive system, in females the menstrual cycle is disturbed. There may be menorrhagia, oligomenorrhea, or amenorrhea. Now the last, that is the neuromuscular system. The common neuromuscular system symptoms are increased sensitivity to cold, headache, lack of concentration, restlessness, then irritability, drowsiness, dizziness, or vertigo, especially while standing, and fainting. And the muscles become weak, and the patient feels lack of energy and fatigued quite often and it quite easily. So these are all about the anemia we have covered in the 2 videos. If you have any doubt or any query, you can ask in the comment section, and do like, share and subscribe to my channel for supporting me and my channel, and thank you so much for watching the entire video.